Hello everyone, how are you doing? Welcome back to my channel. When you want to simplify medical concept for yourself, as well as if you are a medical student preparing for comprehensive exit or COC exam, you are in the appropriate position. So don't forget to subscribe my channel, as well as if you like my video, don't forget to share it for your friends. Now directly I am going to the question. Question number 1. After administering betanicol to the patient with urinary retention, the nurse monitors the patient for what adverse effects? Which is the most likely to occur to the patient? A. Maybe decreased peristalsis. B. Increased heart rate. C. Dry mucous membrane. D. Nausea and vomiting. Take a moment for 5 seconds. The correct answer is D. Nausea and vomiting. With administering of betanicol, there may be the adverse effects related with D, because the adverse effect of betanicol is cause nausea and vomiting by what disturbance of the gastric motility. So the correct answer is D. Question number 2. Which of the following is a definitive sign of fetal death in uterus? A. Absent fetal movement. B. No fetal heart activity ultrasound. C. No fetal Doppler sound. D. Decreased fundal height. Take a moment for 5 seconds. The correct answer is B. No fetal heart activity on ultrasound. It is the definitive sign, but also maybe this is as a diagnosis: absent of fetal movement, no fetal Doppler sound, decreased fundal height, maybe a suggestive for fetal death, but the definitive one is no fetal heart activity or ultrasound. So the correct answer is B. Question number 3. A client with type 1 diabetes mellitus who is multigravida visit the clinic at 27 weeks of gestation. The nurse should instruct the client that for most pregnant women with type 1 diabetes mellitus, A. Weekly fetal movement count are made by the mother. B. Contraction stress testing is performed weekly. C. Induction of labor begin at 34 weeks of gestation. D. Non-stress testing is performed weekly until 30 weeks of gestation. Think over it for 5 seconds. The correct answer is D. Why? The pregnant women with type 1 diabetes mellitus is at increased risks for fetal complication. Non-stress testing is recommended weekly starting at 28 weeks of gestation and increased twice at a week of 32 weeks. At a week of 32 weeks to monitor fetal well-being. So the correct answer is D. Question number 4. When preparing a teaching plan for client who is to receive rubella vaccine during postpartum period, the nurse in charge should include which of the following? A. The vaccine prevents future fetus from developing congenital anomalies. B. Pregnancy should be avoided for 3 months after immunization. C. The client should avoid contact with children diagnosed with rubella. D. The injection will provide immunity against the 7 days measles. Take a moment for 7 seconds. The correct answer is B. Pregnancy should be avoided for 3 months after immunization. Why? Rubella vaccine is, you know, that it is a live vaccine which can be teratogenic because it can cross the placental barrier. Women must avoid pregnancy for at least 3 months after vaccination because of to prevent congenital rubella syndrome, because this vaccine can cross the placental barrier. So she should have to be avoid the pregnancy for 3 months after immunization. Question number 5. A 30-year-old woman with severe dysmenorrhea and dyspareunia and fixed retroverted uterus. The most likely diagnosis for this scenario is A. Adenomyosis, B. Endometriosis, C. PID, D. Leiomyoma. Take a moment for 5 seconds. The correct answer is endometriosis. Why? Endometriosis is often present with retroverted uterus, and it is painful abdomen, painful period. What we call dysmenorrhea is the difficulty for at the time of the period or painful period, and a pain during sexual intercourse. So the most likely diagnosis is what we call it endometriosis. Question number 6. The gold standard for diagnosis of endometriosis is A. Transvaginal ultrasound, B. Serum CA125, C. MR pelvis, D. laparoscopy. Think over it for 5 seconds. The correct answer is D. Laparoscopy. While laparoscopy allows direct visualization and biopsy, this is making the laparoscopy as a golden standard for diagnosis of endometriosis. Question number 7. A client with eclampsia begin to experience seizure. Which of the following would the nurse in charge to do first? A. Pad the side rails. B. Place a pillow under the left buttock. C. Insert padded tank blade into the mouth. D. Maintain patient's airway. Think over it for 5 seconds. So the correct answer is D. First, the priority action during seizure is maintain the patient airway, ABC, and prevent aspiration. And also insert tank blade can cause injury. Question number 8. The multigravida mother with history of rapid labor who is active labor calls out to the nurse or midwife. The baby is coming. Which of the following would be the nurse's first action? A. Inspect the perineum. B. Time the contraction. C. Ausculte the fetal heart rate. D. Contact the birth attendant. Think over it for 5 seconds. The correct answer is A. Why? If our client is complaining just like issue, the first action for healthcare provider is inspect the perineum without ignoring. Question number 9. While assessing primipara during immediate postpartum period, the nurse in charge planned to use both hands to assess a client's fundus. A. Prevent uterine inversion. B. Promote uterine involution. C. Hasten puerperium period. D. Determine the size of the fundus. Take a moment for 5 seconds. The correct answer is prevent uterine inversion. A. Using a boson stabilize the uterus and prevent uterine inversion is when assessing uterine fundus. When assessing the fundal tone. When assessing the fundal tone to prevent uterine inversion. Question number 10. A woman with endometriosis trying to conceive. So, what is the best of treatment, the best management of action? A. OCP, oral contraceptive pills. B. Gonadotrophin releasing hormone agonists. C. Conservative laparoscopic surgery. D. Hysterectomy. Take a moment for 5 seconds. The correct answer is C. Conservative laparoscopic surgery. Why? For women desiring fertility, the conservative surgery helps remove endometriotic lesion. Endometriosis is a lesion and improve the outcome. So the best treatment is laparoscopic surgery. The conservative one is very important. It is enough for today. Thank you very much for listening to me. I would like my video. Don't forget to subscribe, like, as well as share it. Thank you.